I'm Srinivas Sadda. I'm professor of ophthalmology at the Doheny Eye Institute in UCLA in Pasadena, California, and I had the pleasure at the 2026 ARVO annual meeting to present on the topic of subretinal hyperreflective material and its importance as a clinical predictor by taking advantage of data from the TENAYA and LUCERNE studies of faricimab. And so this topic of subretinal hyperreflective material, I think, is quite important to us as clinicians. It's a topic that's been of great interest to me, dating back to more than a decade and a half ago, back in the time domain OCT era, where we identified that in patients with wet AMD who were undergoing treatment, that the presence of this material, and in those days we called it subretinal tissue, we found that that material was one of the most important predictors of vision outcome for patients. So fast forward to today, we've had a chance to look at this now with the latest studies and in the context of spectral domain or high resolution OCT. And basically in this post hoc analysis of the TENAYA and LUCERNE trials that I presented, we studied a subretinal hyperreflective material, or SHREM, that was quantified using an AI algorithm. And so this allowed us to quantify the material in terms of its area as well as its volume at baseline as well as over time. And what we observed was that indeed the presence of this material, especially if this material persisted, let's say at 12 weeks or beyond, the more persistent material there was, especially if it was, for example, over 10 nanoliters of volume, that was associated with worse visual outcomes for patients. Interestingly also, the presence of that material after the initial loading phase was also associated with a lower chance of being able to be extended to the maximum dosing interval of every 16 weeks. So it had prediction both for visual acuity as well as for how many treatments the patient might need. So I think that's of great clinical importance. The other very important observation from this particular study was that there appeared to be a greater reduction of this material with faricimab compared to aflibercept 2 milligram. That's actually quite important, I think, because we haven't seen this kind of differential very often between agents, and given the clinical relevance of this material, that's actually a clinically important difference. And it was a difference that was observed after the loading phase, but then throughout the duration of the study. And we suspect that that could be somehow connected to the Ang2 effect or the Ang2 blockade by faricimab, where this might serve as a type of antifibrotic effect, reducing this SHREM. So I think an interesting observation, one that I think has some clinical relevance, but hopefully something that we'll be able to continue to study in future studies. You know, the presence of this material seems to be important for visual outcomes for patients, as well as for predicting how many treatments or their ability to extend. So prognostication for patients is obviously important, but I think it also further highlights that when we think about a patient we're treating with wet macular degeneration, we really have to pull out all the stops to try to get rid of this subretinal hyperreflective material, or SHREM, because of its negative prognostic influence. So I think as we think about how we approach management, I think it influences our thinking about that, but also helps us think about future therapies and think about where they may play a role, because if we're able to better eliminate this SHREM, that would be a valuable addition to our treatment armamentarium.